the issue of elimination of mother-to-child transmission, which continues to be a major priority for our government. So in the last 2 years, we have put significant resources towards addressing the issue of mother-to-child transmission of HIV. We have been working with other agencies of government, including the Federal Ministry of Health and the National Primary Healthcare Development Agency. We've also been working with Global Fund to try and improve access to HIV testing and treatment for pregnant mothers. While we have made some progress, we're still concerned that a lot of babies are being born with HIV. And the main reason why this is proving very difficult to handle is because we cannot address HIV alone when it comes to antenatal care. We need to integrate it with other aspects of antenatal care. In Nigeria, only about 50% of pregnant mothers come for antenatal. We need to get those mothers to start accessing antenatal care. Otherwise, all our efforts will be limited to 50% coverage of pregnant women with HIV. Based on the results we have had of several surveys, we know that the challenge is all about bringing the mothers to antenatal care. Once they come to antenatal care, 8 out of 10 pregnant women are tested for HIV. So really, the stumbling block is improving access and making sure pregnant mothers can come for antenatal care. We are also working in the area of advocacy, trying to increase knowledge and awareness of pregnant women with regards to HIV. I'm pleased that this year's theme is all about HIV testing, and it's also about self-testing, because there are now kits available that you can use to test yourself for HIV in the comfort of your own home without anybody seeing your result. And then after that, you can then go to a facility to have confirmation. And that in itself would increase testing, because it means you've been given a choice. You can think about it and do your own test first, allay your fears before you go on to have a formal test. We will not relent as a government until we eliminate mother-to-child transmission of HIV. But this can only be done working together with other aspects of the health sector, bringing in other aspects such as nutrition, malaria testing, full blood count testing in pregnant women, and more importantly, getting those pregnant women, particularly those in the rural areas, to start using antenatal facilities. The government is already putting in resources to renovate the primary health care centers, and as a first step of renovation of primary health care centers would be to upscale antenatal care. If you upscale antenatal care, automatically you're going to increase and improve access to HIV care. And that's the only way we can eliminate this issue. The second question had to do with update on the HIV survey. I don't want members of the press to jump the gun. This is a survey. The results will be out very soon, hopefully by March. We have done at least 75% of the 36 states we have in the Federation. We are now in Web 5 and 6 of the survey. By the end of this week and early next week, we will have only about 6 states left to go. And we expect the field work will finish by the 21st of December. There may be a need to do some mop-up in early January. We are now dealing with states that have either difficult terrain or there are security concerns. So we are going on to Borno, Yobe, Zamfara, and Benue. But you will get the results, and I assure you, if you get the results will be interesting, and it will provide us with more leverage to get more resources for the HIV program. Testing. So a straight answer is no. HIV without his or her consent. It's illegal, it is wrong. People have a right to confidentiality. There's a process involved when it comes to HIV testing. Ideally, you should have a degree of counseling. We are trying to normalize HIV testing because unlike in the past, HIV is no longer a death sentence. There are drugs available that work very well. HIV is a virus just like any other virus. It's just that based on its history, it has come with a lot of stigma and discrimination. And we want to eliminate that stigma and discrimination. But it is no longer a death sentence. If you have HIV today, provided you are diagnosed early before you've developed advanced infection, you should be able to live a normal life. But having said that, nobody should be tested for HIV without his or her consent. Nobody. It's not right. And for facilities that are currently doing this, it reflects bad practice. And we need to identify these facilities and work with them to stop this practice. Thank you.
Thank you very much.